Hello everyone, today we're going to talk about otitis media and externa. So when we look at otitis externa, we're really looking at inflammation or infection of the external auditory canal. Now, how this happens is a lot of times our earwax can be really protective against bacteria, and that's for a couple of reasons. One, it helps keep that area nice and dry, right? We know bacteria likes to thrive kind of more in those humid environments, so keeps it dry, and it actually keeps it very acidic in that ear canal as well. So anytime we kind of wash that out or we damage that earwax or we're cleaning out that earwax, we're losing that nice bacterial static effect of it. Well, we see that a lot with otitis externa because of patients that are swimming a lot, whether they're swimming in a really chlorinated water that dries that out, or if they're swimming usually in very hot, humid areas, right? So we get water in there, and then when they're out, they're in this humid area, so we know it's always kind of humid in that external area. Therefore, that bacteria likes to thrive. So that's kind of where we see this happening. Now, some of the more common bacteria we're going to see here is things like strep, and we can also see, staph, and we can also see Pseudomonas. Now, in general, otitis externa is usually pretty self-limiting, benign, kind of goes away on its own. But sometimes, especially with our more Pseudomonas types of causes, and maybe our patients that are immunocompromised, stuff like that, we can kind of see more large infections develop, like cellulitis, and get into the bone, into the muscle, and even necrotizing at that point. So we really want to be careful with those patients that are immunocompromised, watching them more closely than some of the other patients. Now, some of the data we can give subjective, the biggest thing is pain, right? A lot of times we get that pain, and it's going to be more, we can kind of induce that pain when we're messing with the external ear. So whether we're pulling on the pinna or on the outside ear in general, right? Or if we're putting pressure on the tragus, anything like that can cause more pain with these patients. Now, when we go in the look in the ear, usually the tympanic membrane is usually okay here, but we can definitely see some not infusion, but we can see some autourea, we can see some yellow purulent drainage, crustiness, stuff like that. As far as treatment, a lot of times waiting, watching, sometimes depending on the patient. But if we are going to give antibiotics, we're going to go more with like our Cipro or our Levaquin. Those will cover kind of both our strep here and also, sorry, I keep saying strep, staph and Pseudomonas here as well. So those will be medications we can give. Want to make sure we're keeping it nice and clean, clearing that all out, make sure we can get in there. And you'll also see very common giving anti-inflammatories like glucocorticoids and stuff like that. Sometimes even like acidifying agents to get in there and kind of kill off that bacteria. Now, the biggest thing is you want to make sure that the tympanic membrane is okay. It's not ruptured or anything like that, because then we really want to be careful from like aminoglycosides. We want to be careful with some of our acidifying agents, because that can cause more damage to the ear, especially if that tympanic membrane is not patent and not ruptured and stuff like that. Sometimes when they get really severe, it's so inflamed, they need a wick placed to give those antibiotics. That's obviously for a specialist, and that patient should be referred out. Obviously, we want to be checking in on these patients, seeing how they're doing, seeing if the waiting and watching is working, or if the antibiotics are working, and kind of stuff like that. Now, in general, when we talk about education with these patients with otitis externa, is we really want them to stay from anything wet, right? So no swimming for like 1 to 2 months. When you're taking showers, wear a shower cap, earplugs. Some people say like blow drying the air after. We really just want them to keep that area as dry as possible. Now, some other things, you can have some acidifying drops if otitis externa is very common in these patients, like if they're getting it all the time and maybe they are a swimmer, that's what they do, then they can give some of those drops to take after they swim. That'll kind of prevent, hopefully, bacteria from coming up again. Otitis media is a little bit different. So otitis media is going to be infection now of the inner ear. Otitis media, very common in kids, but can happen in adults. Reason it's more common in kids, about like 80% of kids will have at least one type of these infections while they're developing or growing up, is because when you look at the eustachian tube, it's actually straighter and it's more narrow. Therefore, it's easier for bacteria from the nasopharynx to get into the eustachian tube. Now, as we get older, that eustachian tube becomes more narrow, makes it harder for bacteria and viruses, in this case, to get in there. So when we look at otitis media as both bacterial and viral causes, bacterial, now I can say it, strep, pneumonia is going to be more common here, and Haemophilus Hemophilus influenzae is going to be more common here. Now, we know we have vaccines for both of those, right? We have a pneumococcal vaccine. We also have our Hib vaccine. Now, it doesn't cover all those, but it can help out quite a bit. Moving to more viral, so we can see kids get this from RSV, adenovirus, the flu, type B, and stuff like that. So this one's a little bit more common for children or whoever it is to present with an upper respiratory infection, whether it's after their signs and symptoms or during the upper respiratory infection acutely when the symptoms are happening. So more common to kind of see those two come together in this type of cause. Now, what happens at this one, when we look at it, is they definitely can have pain with subjective data, but they can also have more of those upper respiratory infection type signs and symptoms. So like rhinorrhea, cough, any of those respiratory things, fever, maybe they have the flu, they have RSV, stuff like that. They also will usually complain of like ear fullness, ear pain, maybe difficult with hearing, and they can get vertigo. This is one of those common causes of vertigo we can see is otitis media. Now, when we do the objective, obviously all the things that come with the upper respiratory infection, but also that tympanic membrane can look very angry. What I mean by that is like bulging, kind of outwardly bulging and stuff like that, where you don't see that as much with otitis externa. Outside of that, when we look at treatment, guys, this one sometimes can just be wakeful watching again, maybe give them 48 to 72 hours. The other thing I want to make apparent is you can also have this otitis media with or without effusion. So sometimes the effusion can happen in the acute phase, or it can actually be after the infection of otitis media. And as the patient's getting better, they might have an effusion. So it doesn't always mean they're getting worse. It can just be something you see after the infection. Treatment, back to that, watching them, seeing how they're doing. If we're going to go ahead with antibiotics, we can give them things like penicillin antibiotics. So we can give them amoxicillin. If that's not working, we can give them augmentin, see if that helps. We can try, obviously we want to give them a lot of analgesics and sometimes some anti-inflammatories to help out here as well. But in general, we want to just watch them. As far as treatment goes, vaccines are going to help here to prevent this, making sure that they're breastfeeding for at least for the first 6 months, and just trying to keep them healthy. As we know, viruses are usually, and bacterial respiratory infections will bring this on. Okay. Now, the difference between the two, really, when we're talking about manipulating the outer ear, putting pressure on the tragus, pulling on the pinna, stuff like that, we're going to see that more in otitis externa, where we'll see that less in otitis media. Same with that, otitis externa usually doesn't give you those issues with vertigo, whereas otitis media will. Otitis media usually comes with more of those upper respiratory infections, more in kids. Externa, not so much. Now, you can't have them both at the same time, but this is just kind of the difference between the two. Hope you guys enjoyed that. Give me a like if you did, and we'll see you on the next one.